Hello, my name is Jonathan Reimer. Welcome to Smart PT. Today we're going to be talking about body awareness. I think it's an essential element in exercise planning. More people, in my experience, lack proprioceptive control than actually pure strengthening. However, in a lot of our physiotherapy exercise programs, we focus more on the strengthening than the proprioceptive control. I'm going to use the example of Patellofemoral Syndrome at the knee, as I've had a lot of experience, and it's a great example for where proprioceptive control versus strengthening is required. Many of us treat Patellofemoral Syndrome on a weekly basis in our clinic. The typical strategy, as an example, is to strengthen either the VMO or the gluteus medius and minimus. I often find that those muscles have sufficient strength, however, the person lacks proprioceptive control at the knee. I'll tend to use the single leg squat test to determine this. In many cases, the person has an increased rotational or medial drift to the knee. That's causing gluteus maximus and potentially tensor fasciae lata to contract strongly to try to derotate the knee, and in the loaded patella it gets sheared in a lateral direction because of that, resulting in a lot of your patellofemoral syndrome. So my training programs will tend to not only work on exercises that are going to strengthen these two components, those two muscle components, but also to work on that proprioceptive control and retraining the squat pattern. A good example of this is I was working with a bobsleigh athlete, strong as an ox, thighs the size of my waist, definitely no lack in strength, but he was having medial knee pain. When we watched him load the sled in slow motion, we could see that his knee would buckle. So it was definitely not a lack of strength. He could squat myself and my whole family probably repeatedly. However, did have a little bit of directional weakness and proprioceptive loss. We did a test called the crossbody pull, where I use a strap or tensor band and try to pull a weight across my body. You can also do it with pulleys, and try to limit the amount of rotation that happens as you're producing a rotational force at the knee. We were using pulleys in this circumstance. I could pull twice as much weight across my body as this behemoth of a man could. So I felt good about myself, but he was quite shocked. We basically used that as an exercise, that same thing we used to test the strength of his knee in rotational direction. We used that as an exercise. Within a short period of time, he was able to pull more weight than I could, which is not surprising. However, also saw a resolution in his medial knee pain because he regained that strength in a rotational direction and that proprioceptive control. I see that quite commonly, and I think that that highlights the fact that more people are lacking muscle control and proprioception than actual pure strength.